how we got here. I did want to take a moment to acknowledge the land that I am a guest on. I work at the Dalla School of Public Health at the University of Toronto when I'm not working as Editor-in-Chief for Global Health Promotion. And our school in Toronto, it sits on Turtle Island. It is the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples. And the territory was the subject of the Dish with One Spoon Wombat Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. I would also like to pay our respects to all of the ancestors and to the present elders. And I would also invite you to take a moment to do the same wherever you are joining from. Relatedly, the discovery last week of the remains of the 215 Indigenous children in Kamloops has prompted nationwide outrage, understandably, and calls for further searches of unmarked graves. And this serves as a stark reminder of the Canadian state's failure of Indigenous people and also the role of the church, and more fundamentally, the failed implementation of the Truth and Reconciliation recommendations, and really reminded us that we must all take action now and really call for justice. And yesterday also marked another horrific act of mass murder perpetrated against Muslims in London, Ontario, which is about 3 hours west of Toronto, for those of you who don't know where that is. 4 members of a Muslim family representing 3 generations of the same family were run down by a man driving a pickup truck, leaving a 9-year-old from that same family hospitalized. I think these and many other acts of violence that are motivated and continually reinforce the racial, social, and other inequities that are perpetuated all over the world, including in Canada, provide a somber reminder of how important it is to address equity issues deliberately and to call for concerted action. So with that backdrop, I did want to just provide a brief overview. The call for papers that we launched in partnership with Health Promotion International and other international health promotion journal focused on the following question: how is the health promotion community affected by and responding to this unprecedented global challenge of COVID-19? And it really clearly resonated with many academics, practitioners all over the world. We received over 170 proposals for articles in several languages. As you may know, we publish not just in English, but in French and Spanish. And we were delighted by the response and invited 48 papers to submit final versions. And we're delighted to hear from a couple of the authors who successfully met peer review requirements and published their works in our journal. Also really has been a real privilege to work with guest editor Paola Ardiles, who really helped us, particularly with Spanish language papers, but also with the overall collection, which represents contributions from scholars, emerging scientists, practitioners, and professionals in health promotion around the world, who have shared their reflections and insights on a variety of health and social related issues that have been raised or amplified or finally surfaced, although many of us knew these inequities pre-existed COVID. The compendium of studies that we've published really represent an interesting body of knowledge, ranging from cross-country comparative case studies to regional and country studies and in-depth analysis, highlighting the implications and impacts of the pandemic at many levels on social inequities, on public policies, on mental health and resiliency, et cetera. And so I will invite you to also have a closer look at the specific articles, because of course we can't talk about them all today. And then finally, I think we're really thrilled by the regional representation. So we had many articles coming in from Latin America, also Canada and the US, several countries in Sub-Saharan Africa and the Middle East, and Europe as well. So today we're going to focus in on a few articles that sort of represent the Pan-American context. And so the objectives of this webinar are really to just increase the visibility of the collection and journal, and really to stimulate, more importantly, a debate on the issues related to health promotion and health equity, and the impacts of the pandemic and some of the policy responses that we've seen trickling in. So I am going to introduce our first speaker from Chile, and that is Felipe Machuca-Contreras. And Felipe published a paper on titled Políticas Públicas de Promoción de Salud en el contexto de la COVID-19. I'm sorry, my Spanish is not that good. I probably should have asked you to say this, Paola. In Chile, and his presentation will be followed by a presentation by Sume Ndumbe-Eyoh, who is a senior knowledge translation specialist with the National Collaborating Center for Determinants of Health. So each will have about 20 minutes to provide some highlights from each of their papers, and then we will then, if you don't mind, just to allow each speaker to speak to their papers, save the questions at the end of both presentations. However, I would invite you to include your questions in the chat as they occur to you, and I will hand things over to Paola to moderate the Q&A sessions. So perhaps, Felipe, we can start with you. And
next, because I can do the next. Well, first of all, I would like to say sorry for my English. It's not the best, but I'm going to try to do the best presentation. And I would like to thank to Lana, who invited me to work with her in this paper, who is called Public Policies for Health Promotion in the Context of COVID-19 in Chile, an approach from a situational analysis. When we start to working in this paper, in this investigation, we were in a very weird situation in Chile, because we have, as everyone in the world, not too much information about the virus, about the real situation, and we start to growing the quantity of person who has the infection, and start to being a lot of people died, and was the first motivation to start this study, because we start to see that in our country the policies about promotion of that situation, it wasn't being the best option, and a lot of person who has to had some voices doesn't have as the nurses principal. We take some theoretical backgrounds. We start to thinking about public policies that we define as projects and activity that the state designs and manages through a government and a public administration in order to satisfy the needs of the society. We think about legitimacy. It is necessary to act ethically by government, since it allows a better performance within the framework of the normative and prescriptive content. And as a reflection, we share when there is an ethical sense the administration is committed to a better form of government functioning in the lives of citizens and social organization. We start to think about that the policies that the government must be take about the promotion of health in this situation, and we made a confrontation between the public's policies and the legitimacy between them. We took as a aim in our investigation understand the social words and action scenarios in public health promotion policies in Chile in time of COVID-19, because that was the important point. And we took the decision to develop a qualitative research in a post-positive paradigm, and we took the situational analysis to develop the research. We do two different steps. The first step was a virtual consultation through a Google form server type of 10 experts from academic world and the public sector. The inclusion criteria were defined by the research based on expert voices in epidemiology, public policy, public health, and social science. They were consulted about the policies that in their opinion were relevant in the pandemic and which individual and collective actors were present and absent in its development. The second step was the information was obtained through a proactive sampling whose inclusion criteria were document, program, reports, websites, and news related to COVID-19 in Chile from official digital sources such as Advisory Council, Social Table, Epidemiology Department of the Ministry of Health, from the media, speeches, and citizens' news. Course analytics software with which the relevant actors and their speeches were collected, determined by frequencies of mention on Twitter. That's the way that we develop our research. And in our results, we saw that we have different kinds of actors who was present in that period of time. Was the first time, was the beginning of the pandemic in Chile. We had 5 or 6 months of delay of the start of the pandemic, and we were taking the information like 3 months before was by the WHO determined that as a pandemic. We have individual actors. We have collective actors, individual actors as politicians, some head of some universities or college, and principally collective actor as some groups or some experts or a group of experts was very present in the media about the decisions. Constructions of discourses of individual or collective actors, and there was different kind of information. One, it was pretty clear. One was the government line of information who give us, and another was the confrontation about how good it could be the decision in the side of some experts. Non-human elements or actors, especially some institution who gives some advices, elements or actor involved in silence or silenced. That was the main results in our investigation, because it was a lot of different actors, as we mentioned, that doesn't have voice and was not allowed to be listened to. We did a construction of the discourses of non-human actors, and we has some results who give some political plus economic element, or who it's center the decision of the government to allow not take care at all to the people, and all the decision was taken by some economics statements. Temporary element, especially the temporary element, was not has too much time since the beginning of the pandemic and when we start the study. So a lot of confusion, some terms that change, some definitions that change. Chile has a lot of problems with the way that the information was given, how classify the person as positive or not positive, and a lot of different criteria about it. Relevant debates or topics about how must be developed the criteria, how must be developed the lockdowns, was a lot of topics who was in those debates. Social, cultural, symbolic elements. Was a lot of people who give some negatives or not proper information about the pandemic, and was a little bit against the promotion that kind of information. Spatial elements. It's about Chile is a long country who has different regions and has a lot of different kinds of cities. Even the weather, it's different in every region. So all of the information, all of the decision was taken centrally in Santiago, who is actually in the middle of the country, and all of the regions doesn't has any voice in that decisions. Related spatial speeches of an historical nature has to be in the same way, because some groups, regions, person who has a historical not listened voices was the same groups who has that kind of no spaces to talk about it. As a conclusion in our research, we saw a lot of barriers or boundaries who has to be take for the future in that kind of situation. But we saw now, if we even almost a year when we write the paper, we saw that the situation is the same. The same actor doesn't have voice, and nothing in the past with the first wave in the pandemic was resolved, and we are in a little bit in the same situation now in our second wave, that it's been very strong now here in Chile. We start with strong lockdowns again, and we have 0 ICU beds, and we have strong numbers of people who is taken the virus, and a lot of dies. So we are not in the best moment now, even when we reflect about it in the first wave. And as conclusion, there is a strong male presence in different categories and geographic centrally in decision making, as I told you in the last slide. That male presence, it's pretty strong, and the voices who doesn't have voice, principally it's voices of regions, women, dissidents, all kind of dissidents, but principally LGBTQE plus community, boys, girls, all the kids are not allowed to be listened, especially in the education issues, people with disability and rare diseases. So it's very strong, the same voices who always been not listened. Economic actions predominate over health measure actions and poor risk communication, as well as gaps in the application of the National Emergency and Disaster Plan. And we told in the other slides, economic action was the way that the government take decisions, and don't think especially in the health action who can stop the chain of contagious of the virus. And the situational analysis allowed the visibility of all actors, including the silenced minorities, revealing their spaces for protest. That was a plus in the methodology, because we can see how the people who express some special situation about the economic actions, especially, doesn't have the voice who deserve. And this was the develop of our research, and we try to give some point in the paper.
Thank you so much, Felipe. Muchas gracias. It's been really wonderful to hear this analysis of my home country. So I wanted to say thank you on behalf of the whole team here at Global Health Promotion. And thank you for staying on time as well, so we can have a chance to hear our other presenter. So Erica did introduce me. My name is Paola Ardiles. I am here at Fraser University in British Columbia, Canada, which is on the unceded and the stolen territories of the Musqueam, the Squamish, and the Tsleil-Waututh people. As Erica expressed, we are really, it's very important to make note of the context that is happening both here in Canada and around the world, as we're hearing today from Felipe, that the political landscape is really connected to the issues of inequities. And thank you for Felipe for making a very strong case here in terms of both of the discrimination in terms of gender and the voices that the government was portraying, but also the importance of how this government in Chile has really highlighted the economic policies as a priority, which has had, of course, very big implications for the health of the population. So we will leave the questions until the end, Felipe, pero muchas gracias antemano por tu colaboración. Se agradece.
Gracias.
And your English was great, by the way.
Thank you.
Now I have the honor of introducing our second speaker, and she was also introduced by Erica. Sume and I go way back. We were colleagues from our years at the University of Toronto and have managed somehow to continue to work together. I'm very honored to present her because she has been a person that has been such a strong advocate for equity and for racial equity throughout her whole career. And she works with the National Collaborating Centers for Determinants of Health. And this is a very special paper as well, analyzing the political context in Canada, but also it is a team effort that she did with her colleagues at the center. So I just wanted to acknowledge all of that good work that they do for us. So over to you, Sume.
Good morning. Hello, everyone. It's a real pleasure to be here. Thank you, Paula and Erica, for the invitation and for your amazing work putting together this special edition. As both Paula and Erica mentioned, I'm Sume Ndumbe-Eyoh, and I work with the National Collaborating Center for Determinants of Health. We are one of 6 centers funded by the Public Health Agency of Canada, and our center is hosted by St. Francis Xavier University, which is in the east coast of the country in Mi'kmaq, which is the traditional and ancestral lands of the Mi'kmaq people. I live and work from my home in Montreal, which is the traditional homelands of the Ndumbe-Eyoh Nation. I believe one of my co-authors is on the line, Dalla, so just giving her a shout out. Just really want to join Erica's comment and just re-emphasizing just the grief which is being felt across Canada with the findings of the unmarked graves of 215 children, and just added my voice to the calls for Indigenous communities to really identify the other remains and give those children the dignity they were denied in life. And I think for us at the center, when we started thinking about COVID-19 and what our response was going to be as an organization, we really started thinking about this as soon as before the pandemic was declared in March of 2021. We already started thinking about this largely, I would say, in thanks to our colleagues at the National Collaborative Center for Infectious Disease, because for sure we were already paying attention to it. So at the center, one of the very first things we did was looking at the intersections of stigma and COVID-19, because we had already started seeing that coming up. And early on in the pandemic, in April of 2020, we decided to host a series of community conversations, really bringing together folks who work in public health and who work in different community settings, who we knew would already be seeing the equity impact of COVID-19 in their everyday work. And I think Erica mentioned this for us, as I'm sure for a lot of you on the line, the fact that we're seeing inequities play out in the COVID-19 pandemic was not a surprise to us, and it certainly wasn't a surprise to the 13 leaders who joined us during that first series of 5 conversations. So what I'll be doing today is sharing what we heard from those 5 conversations. So following the 5 conversations, our team conducted a thematic analysis of that. As I mentioned, one of my colleagues, Ndumbe-Eyoh, is on the line, and the other co-authors in that paper are Pema Mazinda and Claire Bedka, all at the NCCDH. So following the 5 conversations, our team conducted a thematic analysis, just trying to get a sense of what we're hearing consistently. And so our paper really focuses on that. Through our paper, we had 4 themes which emerged very strong. And I just want to remind us that this was April 2020. I think a year in, a lot of these things feel self-evident. But in April 2020, what we're hearing very strongly for the folks who we invited to join us in these conversations were 4 broad themes. The first was that COVID-19 was really revealing inequities which were built into the system. The second was that our health and social systems were under duress, and for the most part, we're not being responsive to equity concerns. And as a result, we're seeing that COVID-19 was having a disproportionate impact on communities who already experience various forms of marginalization. The last main theme which came up was this sense that there was enhanced momentum for collective action, collective mobilization, and also seeing some policy innovations being led by various governments. So I'll just share a little bit about the 4 themes. So starting with the very first idea of COVID-19 revealing oppressive, unjust systems, and really highlighting the fact that inequities were already built into our system. So for a lot of folks, people talk about COVID-19 a bit as this flashlight, right? So we know that inequities already exist, and for for society at large, particularly for folks who are privileged, for sectors who experience their privilege, that was really just made very visible. Also, COVID-19 was a bit of a hammer. So for communities already impacted, for systems which were already stretched, like a lot of social protection systems, COVID-19 was just dealing additional blows. Lastly, there was a lot of talk in our conversations about planetary health and climate change, and the fact that what we're seeing with COVID-19 in terms of the depth of disruption, which is happening globally, was really a sign of what we're going to likely see as we get more planetary disruptions, especially if we do not act to address the impacts of climate change very quickly. The second theme I want to talk about is how did we respond? And I think, Felipe, a lot of what you're talking about in terms of the response in the Chilean context, I think there's some similarities which we're seeing in the Canadian context. So people really talked about how was the health system, so public health, but then the broader health system, and also other social systems, how were they responding? I think the main sense here was that our social systems were, well, we are in Canada, they're pretty good, they're pretty robust. And at the same time, these systems were not really prepared to deal with the global pandemic. And I'm going to share a quote with you. So one speaker said, "The old system never prepared us for a global pandemic. We knew the old system was reinforcing inequities and leaving people behind. And we also knew that there was a better way forward. We're seeing how the old social safety net was too afraid to really rise to the occasion." And so we heard that sentiment over and over, that in many ways, this was not a surprise, that we know that our systems were not robust enough, but we haven't done the necessary work to ensure that they can respond to pandemic concerns. Similarly, we had some conversations about equity. And one example which really jumps to mind for me is one of our speakers was talking about the experiences of women and girls with disabilities. And so from an ethical perspective, a lot of concern there about how women and girls with disabilities and people with disabilities more broadly were being left behind in the pandemic responses. Even a year in, there were already concerns about how scarce healthcare resources were going to be distributed in terms of like who gets a respirator. And if we think about how people with disabilities are really treated across the world, and the fact that people with disabilities tend to be devalued. So concerns that in the process of assigning scarce health resources, those kinds of biases and inequities will be built back into the system. So people really raising the alarm. This led one of our other speakers to say, and speaking about ethics, to say this: "The time to think about ethics in an emergency situation is before the situation itself. And when we're talking about equity, it has to be built into things beforehand and not on the fly." And so for a lot of folks who joined our conversations, it really felt like equity was being built in on the fly, that it wasn't top of mind for our pandemic responses. So as I mentioned in my introduction, this meant that for a whole host of communities, we were seeing disproportionate impacts of COVID-19. And this impact was really being driven by underlying social and structural inequities. Given who we invited to our conversation, some of the communities who were highlighted, and this is by no means exclusive, but just reflects who showed up for our conversations, who we invited. Speakers talked about the impact COVID-19 was having on Indigenous peoples, on Black communities, and other racialized communities. The experiences of women and gender diverse people was also highlighted, as well as those who experienced precarious employment. And a lot of intersections were also being raised. In the Canadian context, what we've seen very clearly is that essential workers, low-wage workers who are largely women, largely racialized women, have really borne the brunt of this pandemic for a whole host of reasons. Firstly, when life shut down for a lot of folks, these are the folks who had to still go to work, and at the same time also receive less protections even in their workplaces. We talked about folks who experience food insecurity, people who are precariously housed, and as I mentioned earlier, women with disabilities. I think one thing which came up quite early in our conversations in April was concerns around the intersection of policing and the pandemic. And so very early on across the globe where people were paying attention to this, in places like London in the UK, in New York, in the Canadian context, we're already seeing that as public health measures like social distance measures were being implemented, Black communities were being over-policed, Indigenous peoples were being of a police. So a lot of the inequities which were there in those various systems were just being amplified. And I say this to say that this all happened before the global uprisings against structural racism, which happened in May, which began in May of 2020. And so in our work, we're already seeing folks raising concerns about multiple structural drivers of inequities, which I think have only deepened since the pandemic began. So there was a lot of hope at this time, even as all these concerns were raised. The one thing which came through very loudly was that communities were actively organizing. So we saw a lot of community leadership, mobilization, organizing, and caremongering. So I'm sure a lot of you were aware of things like mutual aid groups, which are really emerging at the grassroots levels. And mutual aid groups are usually are not, by definition, they're not necessarily controlled by any one organization. It's really communities with whatever shared interests who come together and say, we're going to support each other in this particular ways. And so folks on the line shared a lot about this idea of caremongering. From an organizational perspective, organizations which already had connections to communities. So I think specifically of, say, community health centers in the Canadian context. And these organizations are community governed and so have stronger ties to communities. In those cases, they're able to mobilize really quickly and be way more responsive to the communities they serve in ways which the formal public health and healthcare system were not necessarily able to, particularly early on. One speaker described it this way. These frontline organizations are already community governed. They are run by and for communities. And so that means that we can tap into the networks of staff, of peer workers, of board members, of volunteers in the community and clients to continue to give advice through the networking structures that we already have and to help make sure that we're making decisions that are reflective of what the community needs and wants and what their current circumstances are. I think that cannot be overstated, particularly in, I think traditional public health approaches are really control and command. And we hear this very loudly when we think about how some of our COVID response tables are, even just the names they have. So it's a very military approach to the way in which public health traditionally responds to pandemics. Well, here we're hearing something different, hearing that this existing relationships with communities was really making a difference. I think in terms of how governments were responding, folks really spoke to a lot of policy innovation. At the time, about 2-3 weeks into the pandemic, we were already seeing things like the Canada Emergency Response Benefit, which was support given by the Canadian government directly to individuals who had faced a loss of income. These policies were by no means perfect. I think there was still a lot of gaps in terms of who was able to access them, but there were still pretty significant innovations. I think in terms of G10 countries, Canada has had one of the most significant investments in COVID-19 responses, which is worth highlighting. There were policy responses, not just at the federal level in Canada, but also at the municipal level. One example which was shared, which was really happening at the municipal level, was around housing. So as a way for cities and municipalities to respond to homelessness and people who are experiencing precarious housing, they're really working with, with motels, with hotels to get people into safe homes. There's been a lot of work done around isolation sites. So these are short-term measures which do not by themselves really deal with the deep housing crisis, which we do have in the Canadian context. So this did not come through in April, but what has happened since then is at the same time as we're going through the pandemic and the housing crisis remains, Canada is also going through a real estate bubble where, coupled with low interest rates, we're seeing in major cities, in places like Montreal, where I live, in Toronto, Vancouver, and even in places where housing used to be relatively affordable, we're seeing housing prices skyrocket, which is deeply impacting low-income, low-wage workers, people who already experience various forms of precarious housing, and that remains a significant concern. I'm just going to end just in terms of our broad themes by talking about transformation and sort of where we go from here, at least the perspective in 2020 and where what we're seeing in 2021. See, I think at the time, a lot of folks really talked about the fact that the kinds of transformations which we were seeing were inevitable simply because the inequities which had been exposed were so deep and so profound. So one speaker said, we just cannot go back to the status quo. It's just not possible. But at the same time, there was a real concern that power and privilege are, these are forces which always work to reorganize and to reassert themselves. So really urging us all to be really mindful about how we, as public health, because that's who we're really speaking with, how we are mindful of that. And I'm just going to share a quote with you. One of our speakers said, I think because this is a matter of privilege and power, I do believe that the urge is going to be to restore that power. And so institutions and individuals, communities with privilege, are going to want to protect their privilege, and institutions are going to cater to that. So this was really offered as a caution that we cannot go back to the status quo. And for us to do that, we have to really be organizing. Since we hosted these conversations in 2021, we have done another series in 2020. We did another series in 2021. And what the shift we heard was really this idea of transformation, and really hear a lot more around the need for public health to organize and to engage in political action. And so that remains a theme. And there's been a lot of work being done, both at the community level, but also in public health, trying to organize again around that. So I'll leave you with a couple of questions as we go into our own discussion. I'm really interested in your questions. One of the things which we always do when we talk to folks in the field is really trying to figure out the extent to which what we were hearing resonates with what you're experiencing in your own world. And I know we're having a pan-American conversation. And also what is missing in some of these conversations which I shared. Are they things which you're seeing in your own work which we did not necessarily highlight through our own conversations? Always interested in hearing from that. So thank you all very much. Paola?
Thank you so much, Sume. That was excellent work as always. And I just was noting some parallels with the two presentations in terms of some of the things, even though very different countries, very different types of governing systems and public health systems. And yet there was a lot of commonalities in terms of of course, the equity issues, but also specifically around gender, care, and the military versus community approaches. And so I'm glad that we're doing this at the same time, because we at first thought maybe we should do the Spanish ones separately, but then we wouldn't actually be able to understand some of these commonalities. And I think actually Genevieve actually mentioned that in terms of some of Felipe's comments resonating with what's happening in Quebec. So I really appreciate that. So what we're going to do, just giving the time, we're going to open it up for comments and questions from the audience. And then what I'll do is I'll do a very short wrap up just to say some final words, but then we'll open it up again for more in case people have more questions and people can stay a little bit past the hour mark. How does that sound?
Okay, sorry, I was a bit interrupted because my daughter is beside, but I found both presentations very interesting. So I'm a professor in nursing at Université du Québec in Rimouski in Quebec, Canada. So my question is to follow what Sume just said about privilege. And I was wondering if in the conversations that you had, or even for Mr. Machuca-Contreras, if you see this in Chile too, about this notion of privilege, I feel it's kind of a little bit shaken during pandemic, because now people realize that their own situation is very conditioned by the situation of all. Because if the healthcare system isn't able to absorb the cases of COVID, then everything shuts down and we're back in confinement. So is there like a possibility, an opportunity through this to kind of surf on that wave of being vulnerable for people that didn't feel vulnerable before, in order to kind of work on solidarity? I was just wondering, what were your thoughts around that? Thank you.
Thank you, Genevieve. That's a really excellent question. Do either one of you want to start?
To get us started, hi Genevieve, good to see you. I think it's an absolute opportunity, and right now in the Canadian context, there is a lot of support for a lot of policies to improve the social determinants of health, and I think COVID has been part of it. The global uprisings have been part of that, but it's not a given, right? Like, so what happens? So what we do with the goodwill and the potential solidarity it's not a given if we don't sort of ride that way, because at the same time as is that potential, we're already seeing that with some of the policies which have been put in place. I gave the example of the Canada Emergency Response Benefit. We're already seeing a sense that people should get back to work, right? And or maybe you got too much from that, so you need to give it back to the. So we're already seeing some of those really deeply ingrained sentiments come back. So I do think there's that potential, because you're absolutely right that a lot of us are seeing not just that the privilege is fragile, but also how deeply connected we are, right? And the fact that an outbreak in a factory somewhere can be enough for for a whole community to shut down. So I think more and more people are seeing that connectedness, just even in terms of human. I think I didn't speak to the global aspect. I think the global solidarity is also a really important piece of this, particularly as we're talking about vaccines, and as more people in the global north are getting vaccines, while folks in the global south still don't have access to that. So I think there's still lots of opportunity for us to raise this issue and build more solidarity, both within our own countries, but also across the globe.
Thank you, Sume. Felipe, do you have anything to add to that?
Yeah, I think that maybe the context is different in Latin America, especially in Chile. We have a social movement really near to the beginning of the pandemic, and we have some feelings about how different are the possibilities of person who has more money in Chile, and think that the pandemic was a confirmation about it. I think that poor people is the common person, and a small part of the society has all the money actually, and the privilege are still in the person who has more money, who has the control of the country. And the poor people, with the economic policies, the support from the government, the way that the health was distributed for the people was pretty different. So I feel that in pandemic was more extreme, that difference, that some people have some privilege and another people has to have the thing that just can reach. And I think that that situation is pretty common in other countries in Latin America too.
Thank you, Felipe. So the call for solidarity seems to be much more challenging in a context where there's such a gap, particularly in relation to income inequalities, because also in Chile, don't forget that we also have a two-tiered healthcare system. So the rich can afford much better care in case they did get sick. And so that's also proving to increase more inequities in health during the pandemic. One thing, though, that I did want to mention that I thought was quite interesting is that Sume brought up the issue around the mutual aid groups as a form of solidarity that have been forming throughout different parts of Canada, and I'm sure in other countries as we're sitting here with people from all over the world. And I've also seen this in terms of the sort of reimagination or relaunch of types of mutual aid groups in Latin America around community kitchens or ollas comunes, So I think that there are ways, unfortunately, there are other really major challenges, but I think important to keep in mind in the context of this conversation is also the issue Felipe brought up in terms of the social uprising that is happening in not just in Chile, but in other Latin American countries, but as well here in Canada. So, when we started today talking about, the horrible acts of violence and hate that are happening right here in Canada, in a country that, from the outside, people think that Canadians don't experience that kind of level of racism and hate. So I think that people are mobilizing. There's a lot of strong efforts in terms of raising awareness about how these issues impact health and well-being. So I think that there's definitely a connection there that we should be paying attention to. I know that we're almost out of time. So what I'm going to do is I'm going to do my final remarks, and then I'm going to pass it back to the participants for more questions if hopefully people can stay. I wanted to let you know that most of the papers that we submitted, that were submitted to the journal around this special issue of COVID-19 were published in 2 special issues. So the March issue is already out, and there's going to be one coming, which will be the June issue that will be coming out later this month. And so we really invite all of you. They're all really excellent pieces of work from very different perspectives. And so we invite you all to read them, to share them, comment, and a special thank you to all of those who contributed. Some of you are here on the call. A lot of patience with having to get the review process under the pandemic that also was faced with many challenges. So I appreciate that. I really appreciate Erica, Anna, and all of the staff for inviting me to be a guest editor. I learned so much from this experience, and really looking forward to seeing the next edition coming out. I also wanted to thank all of the reviewers, many people that were also facing their own challenges during this very tough time, had made the time to review and contribute to this this work. So, and translators, we couldn't have done this without translators. So to all of the staff, translation teams and editors and reviewers and all of the authors, a very big, warm thank you from on behalf of the Global Health Promotion Journal. We are also going to have a second webinar that will be organized at some point during the summer. It will also focus on an international context, and we will be pulling from some of the articles that will be published in the June issue that are coming up. So please stay tuned to IUHPE and the Global Health Promotion social media to learn more about that information as it comes out. Thank you so much, everybody, for attending. And I really look forward to hearing more discussion. So if any can stay, and we'll continue on for another 15 minutes, please. And thank you so much, Erica, for your leadership on this issue and all the work that you do. And she's just saying in the chat that she also echoes the thank yous to everybody. Okay, our numbers are dwindling down.
Yeah.
Okay, so maybe what we could ask is for the 2 authors to put their emails on the chat function, and if people want to follow up, if there's any. Sometimes things come to us after the conversation. So if you want to do that, and just again, thank you so much for your contributions and just a really interesting analysis of both contexts that have their local elements, of course, but also really pertain to the global context as well. So thank you again for all of your good work and collaboration on this special issue.